Hi everybody, Janine here. I'm a nurse in labor and delivery, and I'm here to talk to you today about prioritizing. So you get on shift and you're a little bit overwhelmed on what you just got report on. Call lights are going off, this one needs this one needs that, and your day shift, if you're on night shift, or night shift if you're on day shift, is heading out the door, not willing to help you any longer because they had a long day themselves. So what I want you to do is just take a big deep breath and say, I can handle this. And the first things you're going to kind of question yourself with are, what are you going to do first? And maybe that call light's going off, but all they want is some water or something. Send your aide to do it. But what are you going to do first, as in prioritizing why? You want to really look at all your patients and their medical conditions and why it's most important to do the first thing first. What could happen if you don't do that thing first? Could that person potentially be a code later on that night? Could if it's a social situation, could it be that later on that night you'll get a bad patient satisfaction score, and nobody wants that for the unit. And what's most important to the patient? Sometimes patients want you in there just to talk, and that's hard because you got yourself overloaded with other patients on the floor. Other times it could be they just want a warm blanket. Is that all that's important to the patient that at that time? It possibly could be. Maybe they just want like a hot cup of coffee or a hot cup of tea or something. Things like that. You never know what's most important to the patient to make them feel comfortable with their stay. That's why whatever you choose to do first, before you leave that room, sir, maybe, is there anything else I can get for you to make you more comfortable? And sometimes there is, and sometimes there isn't. And sometimes when there is, they send you on, yeah, can I get some more ice water? Sure, I'll get that for you. And you run down the hall, get them some ice water, come back, and then they send you on another list. Oh, could I get another blanket too? Sure, come back. Oh, can I get some socks? Yeah, sure, no problem. So, it can get frustrating, and but really you gotta put also, like, in prioritizing, think of your ABCs. Like, think of people's airways first. Somebody's having a hard time breathing, or their sats are down, or their vitals are unstable. That's your first patient. So ABCs, airway, breathing, circulation, things like that. Other things that are important is if somebody's IV blew and they need some antibiotics and fluids and whatnot to get them better, you need to kind of prioritize there as well. If it's something like in our unit, you're on postpartum, you get a lot of patients who can get stuff done before discharge. So is it the baby's hepatitis is due at 24 hours of life, and you got to get that at 24 hours? No, hold that off a little bit. Deal with the patient who's IV blue. Things like that. So, and if you aren't quite out in the nursing field yet, I remember on my NCLEX test, the biggest thing they focus on was prioritizing. So always remember, you always want to go with what's going to make the patient airway better, breathing better, and circulation better. And obviously their infection if they're infected. So a little bit about prioritizing. I hope that can help you out. Take a big deep breath and know that you can handle anything. If you can't handle it, don't try and be a superhero, and talk to your charge nurse and see if maybe you can get your assignment switched around a little bit. But sometimes there's nothing you can do, and hopefully you have an aide or somebody that can help you out. Good luck.